Whoever hit you did a good job, I have to say. But FYI, I know sometimes it could be inappropriate to make jokes like that, but you really have to make light of situations like these.
Oh, I find it funny.
Okay, good. That's the important thing. Woo! That was a really good one.
Oh, I felt good.
I felt good?
Yeah.
Good. Relax into this hand.
Oh.
Woo! Come back soon. That feels like years of tension, but
Probably is.
it probably is. Yeah.
I
And
feel like I can move my neck now.
you can. That's the hope. That's the point of it. Hey everyone, thanks for clicking the video. Today we've got a guy who was very unfortunately involved in a car collision 4 years ago and is dealing with post-concussion cervical-like symptoms since. He's seen physio, he's seen massage therapist, he's a really active dude, and I think so far he's actually recovered quite well, but he's still dealing with day-to-day tensions that he just can't seem to quite figure out. He's never seen a chiropractor before, so I'm excited to see what kind of help we can offer him. Pay attention to this one, and have a great rest of your days. Jonathan, thanks for coming in today. So Jonathan is Primal, which is the gym that I work at. It's the latest addition to the elite squad we've got here. But he's been dealing with an ongoing incident for the past how many years?
Probably 3.
3 years now?
2021, yeah.
2021? We're in 2025, buddy.
Yeah.
Yeah.
Oh,
So
4 years.
4 years. Okay, we don't math here.
Yeah.
Math is not us, but powerlifting we can help you with.
I only math in my master's. That's it.
But that's just it. Just master. I didn't math at all in my degree, so that's fine. But past 4 years, do you care to share a little bit about what that is?
Started as an MVA, so basically just sitting.
Motor vehicle accident. He was hit by a car.
Yeah. Rear-ended, wasn't driving, but as a passenger. So concussion after that, dealing with multiple parties, insurance, delayed treatment, had some physiological post-concussion, resolved that. Now it's just sort of tightness in the neck that's been going on for still like the last 2 years.
Okay.
So treatment as I can, tight neck.
As much as you can.
Yeah,
So
that aggravates symptoms. So like towards the end of months, if it's like a monthly cycle that I'm in, it's like headaches, ear ringing, that sort of thing.
So pretty consistently you're getting like neck tension, you mentioned tinnitus, headaches related probably to that neck tension. Yeah.
Yeah.
I always love working with I almost said students. You are a student by definition, but patients who have a background in kin because they understand it all. They get it all. Okay. And you've been seeing physio for that kind of
RMT inconsistently. It's up in St. Catharines. I work in Milton, so it's kind of
a bit of a drive from where we are.
Bit of a pain, but inconsistently, I'd say about when I can get it consistent, it's once a month. When it's inconsistent, it's like every 2 or 3 months.
Every 2 or 3 months. Okay. So you've been doing some things. I know you lift heavy, so you already exercise and do all the physical therapy yourself is pretty much handled alongside some expert guidance, of course. Have you seen a chiropractor before?
No.
First time. I'm flattered. Thank you. That's a trusting situation, right? It only took how many months of you being here before you finally decided to trust me? So.
One.
Was it only 1 month?
I've only been here since 6 weeks. March 3rd was my first
God,
day.
time flies.
I landed from Argentina and just
time flies when you're not paying attention. It really does. Okay. You get kind of stiffness at all down through the lower back? Anything if you're like deadlifting or having like an intense workout day?
Maybe if it's a heavy deadlift session or a heavy squat session, but other than that.
Okay. I'll feel and see if there's anything there at all, but like I understand that the whole focus is going to be really up here for today, okay?
Yep.
So let's get started with a physical exam. Just sitting where you are. I'm going to need you to rotate your head as far as you can to the left for me, okay? So here we're able to get to about 45 degrees. Now as far as we can to the right, please. So here we're actually a little bit less than 45 even, which is 40. So 45 is already pretty low on the range of motion in C-spine rotation. We want to see usually about 80 degrees, right? 80 to 90 is the normal, but we're less than half on both sides. Well, half on this side, less than half on this side. Tilt this left ear to this left shoulder, please. There, we're getting to about 45, so that's actually okay. Right ear to right shoulder. Ooh, oh no, 45, there we go, we made it too. Okay, so that's pretty good. Bring the chin down to the chest for me. Does that provoke any stiffness, tightness, any kind of pulling sensation?
Tightness, right about there.
Right about in that level, okay, yeah. We are a little bit reduced in that flexion movement to these knuckling, as far as I'd like to see. Now let's look up towards the ceiling, please. How's that? Okay, any pinching back here? No, that's fine?
No, it's more inflection.
Okay, fair. So you were rear-ended, you
Yep.
said, right? Okay, that makes sense with that. When we get rear-ended, we get something called a coup contra coup motion. Essentially, when you get hit from behind, that will jolt your head backwards. You're going to hit your head on the rear neck support behind you, and that's going to throw you forward, and then the jolt of the stop of the car is going to bring it back. Okay, it's that back motion can cause the brain to literally rattle against the skull, which causes a TBI or concussion, traumatic brain injury. That's probably what happened to you.
Yeah.
Yeah, it was pretty violent rear ending.
Yeah, like we're at a stop and the dude's probably got an 80 off an off ramp.
Oh my god.
70 probably. Yeah.
You know, I've been in a car crash very similar to that. I was at a full stop.
Yep.
18-year-old kid, pickup truck, driving high marijuana, flew into the back, me and my little sister in the car. I've never been closer to physically harming a man. I almost physically harmed this man.
Yeah.
Like I made sure my sister was okay.
Yep.
And then I looked to see if I had any weapons to beat this guy up. Fortunately, I didn't. But anyways. Okay, so tension. Now let's go ahead and poke in here. I can't see his face if he's being reactive.
The one on the right side.
Right side's worse for you?
It's a little bit more right. There's tender.
Yeah, okay. We're looking in at the upper traps for certain there. Both arms up for me. Keep them there. Don't let me move them, okay? Nice and strong. Strong. Good. Strong. Awesome. Arms forward. Curl the wrists backward, please. Good. Turn over. Curl wrists inward. Fingers curled for me. When was the last time you had a motor screening like this done?
They didn't even do it when I got my concussion.
Really? Yeah. That's
it was more visual vestibular.
Okay, so they were doing more of the cranial nerve stuff. Okay, I'll go ahead and squeeze fingers there. Yeah, so the cranial nerve screening is obviously what you do want to do off a fresh concussion. Him, 4 years ago, if you've had it done, do you have, to the best of your knowledge, aside from the headaches, any kind of visual,
if I'm sitting at a computer for more than 3 hours, like writing my thesis, it's a pain.
Yeah,
so like I used to be able to sit like grind out a paper in like 12 hours. 3 hours I'm checked out.
Okay.
Like focus wise, and then headaches from that, but not so much.
That's actually good that you're taking a break anyways.
Yeah.
So I'm gonna try to consider that as a win.
No, it's a win. It's a forced, and then it's bright lights at night. So driving with that's headache inducing. Never before.
Never before. Okay, so let's start down in the T-spine, and then we'll work our way up to the neck. Now, you were mentioning, so we actually have a lot of tension in the rhomboids, even up here. The neck and the upper back, they're very connected biomechanically. Okay, if you're getting issues in your C-spine paraspinals, which are the muscles in your neck, you're going to be having issues in the neighboring area, which is your upper back or your T-spine, okay? Anyways, lots of hypertonicity right here. Did you just crush a back day or no?
No.
No? So you were just doing, actually, you were doing squats in there.
I did maybe 3 sets of rows, but
that's not enough for that. Would you say the right side's worse than the left when it comes to your symptoms usually?
Yeah.
Okay. Left side's definitely hypertonic too, but it's not as bad as the right for sure. Okay. Oh, wow. Okay, so did that feel good?
That felt good.
Okay, good. I wasn't even trying to do that, but it happened. Okay, which is usually a pretty good indicator that someone is very, very tight, very, very tense, and can benefit from this. If I don't have to try and the job's just doing it for me, yeah, they're probably in the right place. Take a breath in for me there. All the way out. There we go. Nice. And I'm going to bring the microphone over here because I'm going to do a combo adjustment, which is supposed to really get this base of the neck into the upper back here. Breath in for me. All the way out. Okay, that is challenging. Darn. Breath in. All the way out. Wow. Whoever hit you did a good job, I have to say, but FYI, I know sometimes it could be inappropriate to make jokes like that, but you really have to make light of situations like these. Find the humor, right?
Oh, I find it funny.
Okay, good. That's the important thing. Okay, one more try up here. Breath in, all the way out. There was a small one there. That was very deep, though. So what drew you into kinesiology?
Always interested in it. Took it in high school. Broke my jaw.
Broke your what?
Broke my jaw.
Broke your jaw?
Yeah, realized I didn't want to go to school for business and picked a kin.
That must have been very painful. How did you manage to do that? I'll get you to lay on your side facing the wall, by the way.
Kicked in the face. Soccer.
In the face?
Yep,
Soccer?
goalie.
I was about to say, they know they're supposed to be chasing after the ball, right?
Yep, I made the save, he got my face.
Who's the real winner in that?
I'd say I made the save.
I'd say you got kicked in the face, but okay, we'll have to agree to disagree for that one. Bring this leg up for me. Good. Just relax right there. Take a big breath in for me. Okay, I'm going to roll you towards me and breathe out. I promise you're not going to fall. This. Get you right there. Bring this leg up. Scooch the hips closer to me. Thank you. Awesome. All right, big breath in. All the way out. There we go. There was there's a little one. Now we're going to get into the neck. The neck is definitely the primary area of concern for Jonathan here. I know the right side is feeling tighter, but we're going to get started feeling through the left as well. Now, to me, obviously, my hands are going to tell me where I feel tension, but I want you, if I find a spot that just zings, that refers up into the head or shoots down into the traps, I want you to let me know, okay? Because obviously I can't perceive your pain. So when you do see
Right there.
Oh, right there? Yep. Okay, so that's maybe about halfway down his neck there. Okay, so that's maybe like a C3, C4 area. When you do see your RMT or your physio, what do they do with you typically?
It's usually just manual therapy.
Lots of manual therapy, eh? Okay. Did anybody walk you through the deep neck flexor strengthening program, or are you aware of it?
I'm aware of it.
Yeah.
Like, I know it just based off of kin background.
Do you do it yourself ever?
I was in early rehab.
But now you've probably surpassed that.
Yeah.
Eh? Okay, good. Just want to make sure that the foundations were covered once upon a time. That's obviously important. Okay, so that was the right C3, right about there.
Yep.
That's what we're going to hit first. Okay. So I'm going to move this on over. Okay. So to have your neck adjusted, I know you had the RMT do it before, but I'm going to get you to just turn your head as far as you can to the left. Good. And then I want you to just relax into this hand as if you're trying to sleep on a pillow at home. Okay. And from there. Woo! That was a really good one.
Oh, that felt good.
That felt good?
Yeah.
Good. Always reassuring when the patient says it felt good too, because that was loud. That was like opening a can of pop. That was loud.
Right about there.
Right there. Okay.
Yeah.
So there we're a teeny bit lower than the other side. That's a C4, C5 is going to be my guess. That's a fun one. A little guitar string in there.
Oh, yeah.
Now I understand that, well, yes, you helped me out with a video today that, like, you were actually having a flare up the other day, weren't you? It was kind of getting in the way for you?
Yeah, a little bit.
Yeah, okay. Has that kind of cleared up? Is feeling a little bit better today?
Yeah, like I don't have a headache per se today.
Okay.
The other
all
day
right.
was a...
Reason I ask is because if you were having a particularly bad day, I would definitely offer the acupuncture today, and we can still do it if you'd like to. But if you're just having a neutral day, then maybe not. All right, so again, relax into this hand.
Oh.
Woo. Come back soon. Hey, that was great.
Oh.
That feels like years of tension, but
Probably is.
it probably is. Yeah, that's okay. Good. Up to right. Slowly down to left. Now this is MRT. Does your massage therapist do a lot of this?
She sprinkles it in.
Sprinkles it in. Okay, good. Up to right. Down to left.
Right there.
Yeah, that's nasty.
Yeah.
What would you say has been the most beneficial thing for you recovering from a rather severe TBI?
Physical activity.
Physical activity,
So
exercise.
when-
I love
yeah.
that. Yes.
My lab ran a concussion study.
Mhm.
So we did the Buffalo concussion...
Buffalo concussion sliding scale
Yeah.
test. That's the
test.
treadmill
We did
test,
the treadmill
right?
test,
Yeah.
and then a...
Right, down left.
If I'm not... I know the paper's going to get published in the next year or two.
Oh, well, spoilers. Yeah.
But I know it was low to moderate cardiovascular activity based off of onset of symptoms,
Mhm.
and that was
The most beneficial
Yeah.
factor. So getting a little bit more active. Go for walks. Don't let it get in the way of your
well,
day-to-day.
it's brain blood flow too, right? That's
Exactly.
biggest
No,
thing
the
with
blood flow
concussions.
brings the building blocks. Exactly. Face forward. Tilt the right ear to the right shoulder, please. Good. Now slowly tilt left ear to left shoulder. Now, if you at home get a concussion, most important thing you can do is go see a practitioner. Okay, your GP to start, then either a physio or a chiro that's probably exercise based. That's going to be quite beneficial for you. Okay. So right to right, or a massage therapist. Shout out to the massage therapist there. Left to left. Slowly down to right.
Oh, I felt another one there.
Oh, we're going to go hunting for all of them. Don't you worry. To left, down to right.
Hunting for rabbits.
It's wabbit season. Duck season.
Oh, it's funny. My brother's out for turkeys right now.
Really?
Yeah.
Is he like Northern Ontario?
No, he lives in Toronto. He just drove out.
Okay, I was gonna say, I was like, I don't know too many turkeys that are actually birds in Toronto. Know a couple of people, but they know who they are. Yeah.
Well, those are Turks, not turkeys.
Oh my god, not what I meant. But okay, up to left, down to right. I was shouting out to some idiot friends I had. So like Jonathan said, physical activity within reason, okay? Don't immediately run a marathon because people love to take what I say on the internet out of context. A physical activity is beneficial for the recovery process of after having a TBI. There used to be this belief where you need absolute rest for like 7 days, you're in a dark room and whatnot. That's kind of been found to be outdated. I mean, maximum 24 to 48 hours of just rest, but then we want you up, we want you slowing, moving around. Don't take just my advice for it. See a licensed practitioner, but the idea behind TBIs and the treatment of them has evolved. So don't follow the old guideline that your mother's parent or whoever's telling you to do. Follow what a modern day practitioner is telling you instead, okay? There you are, darling.
Oh, that's good.
And that's pretty much what I do for now. Again, if you ever get like a bad headache flare up, let me know and we'll do exactly this, but we'll also add in the dry needling.
I'm good for 1 month.
Very, very effective for headache or migraine, concussion, neurological type stuff. Okay. Did you have any questions for me for now, or are we kind of good until next time? No. Well, again, thanks for helping out today.
100%.
Always happy to have you in. And
I feel like I can move my neck now.
You can. That's the hope. That's the point of it all. But thanks for coming in, dude.
Thank you.
I'll see you tomorrow.
Well, it's almost like we work together.
We work together.